everybody, welcome back to my channel. So today we're going to discuss a topic that a lot of you have asked about, and that's what's the difference between conventional and immediate dentures. So I'm going to explain some of the differences between the two and try to help you decide which option might be better for you. And I want to thank Ivoclar Vivadent for supporting my channel and sponsoring today's video. Ivoclar is a dental manufacturing company that produces a lot of products that dental professionals use to treat patients like us. To learn more about their company, visit the link in the description box. So immediate dentures are dentures that are placed in your mouth immediately after extractions. And because of that, one of the main advantages of getting immediate dentures is that you don't have to go without teeth. Typically, the mold's taken of your mouth while your teeth are still intact so that when you go in for extractions, they've already constructed the denture and they put it in immediately after your teeth are removed. But one of the lesser known benefits is that they can help protect your gums and aid in the healing process. This is because they cover the extraction site and gums and provide a protective barrier. And that can help prevent infection and minimize any kind of trauma to the healing tissue. So I did go the immediate route. I got immediate dentures because I just couldn't imagine having to go without teeth for an extended period of time. I was young. I was 26 years old. Yes, I did it. I went through with it. I knew it was necessary. But just for me personally, I feel like it would have been a lot more difficult for me leaving the office after extractions if I didn't have teeth. And that's just, it's a personal choice. One of the obvious drawbacks is that as everything starts healing in your mouth after extractions, your gums and your bone is going to shrink. And because of that, the dentures are just going to become loose. It is what it is. When you get immediate dentures, they take impressions before your teeth are even out, and things are going to change pretty rapidly. At first, they might fit really well, but then you're going to need a lot of adjustments and relines to keep them fitting properly as your mouth goes through all those totally normal changes. And for some people, that's just really challenging because, loose fitting dentures come with problems. It can be difficult to eat. Talking with them can be a little challenging. When they're loose, they tend to rub up against your gums, and that can create sore spots, and sore spots can sometimes even get infected. That's one of the obvious drawbacks to getting immediate dentures, and it's especially difficult when people aren't mentally prepared for that. When they go in with these expectations that these dentures are supposed to fit the same way the whole time, and they didn't really know that it's completely normal for them to just not fit. I think another drawback is that this is usually an added expense and they're not permanent. A lot of people call these temporary dentures or temps, and that's because during that healing period, your mouth is going to go through so many changes that at the end of it, usually between 9 months to a year, they need to be replaced because they no longer fit the new environment of your mouth. And so that leads me to conventional dentures. Conventional dentures are dentures that you get after your mouth has healed from extractions. So you go in, you get your extractions, you wait a period of time, and then you go through the whole process of having dentures fitted to your mouth after it has healed. And this is generally around about 3 to 4 months or so, sometimes maybe even a little bit longer. But one of the benefits of getting conventional dentures is that you're going to get a much better fit. And typically when I hear from people that get conventional dentures, that was their deciding factor. They didn't want to have to go through the challenges that come with getting immediate dentures. They wanted to wait, let their mouth heal, and just get a better fitting denture. But the drawback to that is that you will be without teeth for an extended period of time. And for some people, that's just a deal breaker. That was something that I couldn't have done at that time. And honestly, if I were to do it again, I'd still go the immediate route, even with all the challenges, even with the extra expenses of having to get adjustments and relines. So basically, it just comes down to your own personal preference, whatever works for you. If you can deal with going several months without teeth, then that's ideal because you're gonna get a better fit, they're gonna be a lot more comfortable, and that might make learning to eat and talk and everything a lot easier for you. But if the idea of having to go without teeth is something that you're just not looking forward to, and you can deal with the challenges that come with immediate dentures, then that would be the better option. And before I go, I will just show you guys, like I always do, I always show you these. I'll just show the top of each set. It's easier to hold that way. This was my temporary dentures. They were inexpensive. I did pick the shade. I picked the tooth shape to an extent. I was happy with them. I liked them. They weren't the greatest. They're, not the highest quality, but they're not really meant to be high quality. They are temporary. I had to replace them. And so when I did replace them, I got these and I liked them a lot better. I had a lot more influence over the outcome. I decided, I wanted whiter teeth. That was That was another thing that I felt was good about getting the temporary dentures, is that it was a small investment. Like the whole procedure, I think, was like $4,150 or something like that, but that included extractions and everything like that. The actual set was like at the time 800, but that was 2010, so it's been a while. Prices have probably skyrocketed. But it wasn't a huge investment for this set of dentures, so I got to wear them and figure out like what did I like about them, what did I want to change, and I took all of that into consideration when I got this set. So I decided after having this, which they were whiter when I first got them. I'm a coffee drinker, so they stained up pretty badly. But because of that, I decided I wanted to go whiter. So I got the bleach shade for my final set of dentures. And then, you know, minor modifications in the shape of the teeth and kind of the position and layout. Even the color of the gums were slightly different. So I'm glad that I did that. I feel like immediate dentures, yes, it's not really fun when they're not fitting properly. It's not fun when you have to go back and pay for like relines and things like that. That all depends too. Sometimes they include relines in the package when you pay up front, and sometimes it's just additional expense that you have to pay out of your pocket. Like back then it was $150, I think, to get a reline. It does cost more money, but I was willing to deal with all those challenges just so that I didn't have to go without teeth, and learning how to function with those teeth, paying attention to what I liked and didn't like, it made it a lot easier to pick a final set that I was really happy with. So if you're on the road to getting dentures, let me know which way you're leaning. Are you gonna get immediate dentures or conventional dentures, and why? And if you already have dentures, did you get immediate dentures? Did you regret it? Did you get conventional dentures? Are you still in the healing period and waiting to get your teeth? How have you been navigating going without teeth? What kind of adjustments have you had to make? And are you comfortable with your decision? Do you wish that you had gotten immediate dentures? Let me know in the comments below. So that's it. That wraps up today's video. If you have any questions, drop a comment, and I will see you guys again next time, and y'all take care.